So, for instance, if we had a patient undergoing a complicated fat transfer after an explant, and we're doing this at the same time to give them optimal results, we want everything in their diet, everything controlled to the point where we're going to decrease inflammation. We're going to increase the amino acid availability to enhance recovery. So we want to know the foods they're putting in, which is the fuel for the patient to recover on. We want to make sure those are all things they can absorb without sensitivity. And we want to make sure they're the right kinds of foods. We want, say, meats or poultry that are pasture-raised, grass-fed. We don't want them to have vegetables that have GMOs in them, because that increases glyphosate levels, which has lots of downstream effects and can increase your disposition towards leaky gut and lack of absorption of nutrients. If I feel that in your history, as we discuss what's going on with you from an environmental standpoint, if you live in an area or had a recent home renovation or had a big water leak, then you're very at risk to have had a toxic mold exposure. That, in concordance with a genetic predisposition to really limited detoxification ability, either through limited glutathione metabolism, limited DNA methylation, limited at the mitochondrial level superoxide dismutase to handle oxygen-free radicals. If you have that kind of disposition that I recognized during a discovery session, then we're going to add more genetic testing to your preoperative situation so that we figure out both upfront how you're going to handle and detoxify, so that on the back end, we're managing all of that more appropriately. It may be modification of nutraceuticals so that we have supplements that can really help you detoxify more efficiently, because you shouldn't have glutathione, or you should have things that help you methylate better.